Hey, welcome back to The Long Game, the podcast where we explore the strategies, stories, and innovations shaping the future of long-term care and senior living. I'm your host, David, and today we have an incredible guest who's redefining what it means to age with dignity, purpose, and aspiration. Adam Kaplan is the founder and CEO of Solera Senior Living, a company that's challenging conventional thinking in senior care by blending contemporary design, hospitality-driven services, and innovative operational models. With years of experience from his roots at Senior Lifestyle Corporation to building a portfolio of top-tier communities with Solera, Adam has a unique perspective on where the industry has been and where it's headed. We'll be diving into everything from the challenges of navigating a labor-strapped industry to the role of technology in transforming how we care for our aging population. And of course, we'll hear his vision for creating environments where residents want to live, not just where they have to. So whether you're in senior living, healthcare, or just curious about how to build sustainable, forward-thinking solutions in a rapidly aging world, this conversation is for you. Without further ado, meet my friend, Adam Kaplan. Welcome to The Long Game.
Thanks for having me.
So could you start by telling us a little bit about yourself and how you ended up here?
Yeah. So I actually grew up in the senior living industry. My father started a senior living company in '83, so shortly after I was born. And my dad, he came from nothing, and he started in hospitality, then went into commercial real estate, and decided that he saw a big opportunity to create luxury independent living communities. And he started with a pretty ambitious project, about 476 units in Chicago and Edgewater Beach. His second community was also pretty ambitious, about 275 units on the North Shore of Chicago. And I would go with my dad on the weekends to visit the communities. And the first thing we do is walk into kitchens. Each building actually had a little mini donut hole maker. And
Specifically donut holes, all of them?
Yeah. Oh, yeah. Little mini donut holes.
Were those huge in Chicago in the 90s?
My dad came out of hospitality. So he likes, to
Oh, that was like that was his signature move.
Yeah. Exactly. Okay. Yeah. So it was like something just like to surprise and delight people. So I'd make it with the chefs, and then I walk around the dining rooms, talk to the residents, pass out the donut holes. And then when I was in high school and college, I interned in restaurants, hotels. I went to undergrad for hotel and restaurant management at Cornell. And I decided to pivot when I graduated and go to actually work on the finance side of the business. And I joined Merrill Lynch Capital in the healthcare real estate finance division. It's an incredible experience. I spent 3+ years there as an underwriter. And then in 2007, I decided to go into my family business. I spent 9 years there, and I pivoted back to operations. So I worked in every capacity. I was an executive director. I moved into various corporate roles. And then ultimately, in early 16, I decided that I wanted to do something more entrepreneurial. I grew up with as I mentioned, a very entrepreneurial dad, and had ambitions to do something on my own. It was kind of something I just needed to be my own person, step out of his shadow. So I launched Solera Senior Living, which is a fully integrated operator, developer, investor. And we'll finish the year with 14 properties, about 2,000 units. And that's a combination of development projects. We built 5 communities located in high barrier to entry markets. That was when we launched, that was where we focused. We've refocused our efforts more towards acquisitions, select third-party management for experienced institutional investors, and then we are actually in the process of acquiring a management company. That deal will close on February 1st. And so that's Solera. And then a couple of years ago, I decided to partner with a couple of individuals that invest in age tech, which is early stage tech and tech enabled services companies in senior care, and launch Equitage Ventures, which is a early stage venture fund.
I totally want to talk to you about technology, and I also want to talk to you about a luxury take on senior living. But first, I'm just so curious about your dad. Was he excited for you to go out on your own and model him that way, or was he really looking forward to you coming in and taking over?
Well, my dad essentially trained me to be a successor from probably the age of 4 or 5 years old. And that started when I would go with him to visit buildings. I'd go with my dad to meetings in New York. I'd go with him to attend conferences. I went to the ASHA conference, and I played in the golf tournament. So I got to know a lot of people in the industry when I was in high school, when I was in college. He was really the influence for me to study hotel and restaurant management, because he felt that having that background in hospitality was important to building and to operating senior living communities. As I mentioned, I interned in restaurants and in hotels, while I was in high school and post college. So he trained me to be his successor. I decided it was a good decision to go post college and work for Merrill. It was great training ground. I had some amazing early mentors, and I learned the financial side of the business. And it's pretty rare in senior living that you have operators that actually have that foundation on the capital side of the business. And I'm really fortunate that I did it early in my career. Then went into the family business. It was a great 9 years. Candidly, would not be where I am today had it not been for that incredible experience to immerse myself in operations. And, at the time, which was, one of the leading senior living operators. Honestly, it is a challenging decision for me. I really needed, my dad cast a big shadow. He's a, very successful entrepreneur, came from nothing.
ASHA Hall of Famer, right?
Yeah, absolutely. Literally. It was very rewarding for me, to help to, be responsible for taking the company to the next level. But honestly, I think my dad already has an incredible legacy, and I needed to build my own. And, it wasn't the easiest decision. But it was the right one for me personally. And I think that, it worked out for both, parties, because Senior Lifestyle lives on and has a great leadership team. And, for me, I can take all the amazing things that I learned, during my time at Senior Lifestyle, and candidly the time being mentored by my father, and, leverage that to go, do something on my own.
That's awesome. And sorry for jumping into very spicy questions. We're we're an aspirational Joe Rogan pod here,
I love it. I love it.
Yeah.
I listen to a lot of podcasts, so
Okay.
I like authenticity.
Okay, I appreciate yours, and so I want to jump back to senior living, and I think it's so cool that your dad specifically pushed you to study hospitality. Restaurants was his background. You're in tech now, so you can appreciate a lot of innovation is really just cross fertilization. Like, oh, in sawmills we get rid of the sawdust like this, and I was like, can we do that in houses, like for consumers? And now you have a vacuum, and that's how that was invented. So I'm curious what your thoughts are on senior living for a lot of people is, and I thought of as a necessity. You get old and you have to live somewhere, but you're trying to trailblaze here and make it aspirational. I cannot wait to end up in Sunrise. So what are your thoughts on how the industry as a whole needs to change?
Yeah. So, when I started, which was April 1 of 16, one of the things that was important to me was to build places where people aspire or want to live. And that could be for themselves or for a loved one. And I really struggled because I talked to a lot of the industry pioneers, and they I asked them, which community would you move into? And people would always say, well, it's not for me. And I'm an age at home. Candidly, I felt like that was a flaw. And I think that it was important that the next generation of leaders challenged that assumption and started to build communities that were much more aspirational. And you start by building them in the right locations. We focus on what I would describe as like kind of more first ring suburbs. So they're more urban locations. Thus, people, have lived in that area their whole life. They don't have to, go 10 miles away, 15 miles away to move into a senior living community that meets their needs. The other thing is design. And, kind of as you mentioned, it was just taking a playbook from other industries, from restaurants, hotels, from resorts, from spas, from country clubs, and taking what worked in those environments and integrating them into senior living. One clear example is open kitchens. Every single one of our communities that we built has an open kitchen. So you have a line of sight into the kitchen. You can see, the chefs working on the line. They all have pizza ovens. So it's playing off all those senses, and it's much more experiential. It's kind of like theater. And bringing that in.
Like a high-end restaurant.
Like a high-end restaurant, exactly. And a lot of what I try to do is de-institutionalize the product. People think of senior living, they still think of it as a nursing home. Not there's anything wrong with a nursing home, but, they think it's a place I'm going to die. And, I want it to be a place they're going to live. They're going to flourish in their final years. We owe it to this population, and we owe it to their loved ones. So, real estate location, the design, and then thirdly is the operating program, marrying the program with that design. And, a good example would be recruiting our culinary directors, our chefs from outside of senior living, and bringing that fresh talent, and elevating the game, elevating the experience. And that could be the way that the plates that we buy, the dinnerware, it could be the way that the meals are finished. It could be the recipes, but creating that elevated culinary experience in senior living. So you're not just in this beautiful setting, but that the actual culinary offering aligns with what you would expect when you visit and you see what the designs are like.
So you're doing like a lot of hiring outside of the industry. Does that make it easier or harder? Because hiring in the industry, it's hard to begin with.
The answer is both. So, when you hire inside of the industry, you have experts who they're battle tested. And, a good example of something that's quite different in senior living is just, if you're a great chef, you can't go hide in your kitchen. You gotta be visible. You gotta walk around that dining room. Right. You gotta talk to the residents. You gotta talk to the families. And honestly, you gotta be pretty humble. And we've hired people, and they can't take that feedback, that negative feedback. Their ego's bruised, and they just that's just they'd rather go back to the restaurant industry. And then you find people that they have enough self-confidence in themselves. It's not about their ego. It's about doing something more meaningful. And so you can bring that talent into senior living, elevate the experience, and it's a win-win. So it's a risk. Not everyone's going to work out, but we have gotten better over time at really assessing the type of profile person that's going to thrive in our set.
That's cool. What do you think about community? Because you're thinking in terms of design, and you're designing space, and you're designing operations around the space. Are you also thinking about, you want to live in a place where you have a community, very hot topic in America, 2024. Are you thinking about that in your senior living places as well?
Yeah. So I don't know if you know this, but the name Solera, it's actually a Spanish word.
Español. Claro que sí.
It means blending of wines of different ages. And that was the reason why I picked that name, is I wanted something with a positive associate with aging. wine and cheese. Didn't want to name the company after a cheese. Didn't think that was a great idea.
Yeah, no, I think that was thoughtful. That was very
So went with wine. I love wine.
very classy.
And
did you know the word
Solera.
Solera before you were in the branding process?
I launched the company, and the first week I did was just brainstorm ideas for names.
That's so cool. I'm just curious if you like knew a lot about wine.
I did.
Okay, so this was a word. Wow, that's very fancy.
I did not know the word. I did not know
Okay.
to be clear. I did not know the word.
We're doing authentic here. Yeah.
I'm
Yeah.
not. I am willing to be very vulnerable. That's not probably the most vulnerable
Humble.
I've been
Adam
this week.
Kaplan once told me you got to be humble.
But you know I did take 3 wine courses in undergrad. I took wine tasting.
Because hospitality. Oh man.
It's the most failed course at Cornell, believe it or not. And then I took wine culture and history 1 and wine culture and history 2. So
wow.
Yes.
So you crushed that. So knew what it was. You just didn't know the Spanish word for it.
I did not. Yeah. So I loved it. It just really spoke to me.
Yeah. Very tasteful.
But the reason why it spoke to me was partially because I wanted it to be a place that was welcoming for not just our residents and families, team members, but for the community at large. One great example is our building in Kensington, Maryland. We took 2 historic buildings. We integrated them into the design. One of the buildings is a coffee shop cafe. We actually went with a designer that specialized, was the top restaurant designer in DC. We hired them to give them its own look and feel. That place, you walk in there and there's people, in their 20s and their 30s posted up with their laptops, working remotely, drinking a oat milk latte.
They're doing that in your facility?
It is a separate entrance and it is connected to the main building.
Wow,
so it's 130
so cool.
It's 135 apartments, independent, assisted and memory care, and it's got 2 historic buildings, and that we renovated those buildings and integrated them in. So it's a good example of, I think, how the buildings can be intergenerational and it can work successfully. So community means certain things to different people. I recently watched, I don't watch a lot of TV, but this.
How do you have the time?
You make the time for the things that matter. I tell people that all the time because people say, I don't have time to work out. You do. You make the time for the things that matter. For me, like fitness, really important because it helps me manage my stress and it makes me a better dad and it makes me a better leader and have better clarity and better energy levels. So I do that. Don't always find time to watch TV, but I did watch, I think it's The Inside Man. I might be misstating it, on Netflix with Ted Danson. If you haven't seen it, it's a must. It's a must.
Okay, this is a recommendation from a guy who has to make time.
It's our industry should have paid for Netflix to produce this show. But without ruining it, at the end, one of the things that I found most touching, most relevant, was about the benefits of senior living. It's about a guy who...
An American death row prisoner with a sideline in solving mysteries? Helps a young British journalist?
No, I'm definitely I'm definitely off on the title. A Man on the Inside. A Man on the Inside.
Okay.
Is the name of it. Ted Danson, Netflix, just came out. He's hired by a private detective to solve a case about a woman whose jewelry is allegedly stolen. And so he moves into the assisted living and memory care community. It's really, really well done.
It's the guy from The Good Place.
There you go. Yeah, Ted. We must be have a pretty wide age gap because Ted Danson's kind of a legend.
Yeah, I mean, I'm actually like famously bad at names of celebrities. That's the truth.
Okay.
My wife, I outsourced to. Anyway, I have no idea, but I did watch The Good Place with my wife, and that's the same guy. I'm sorry, you were saying.
Okay, well, it's excellent, and
he's got a new lease on life.
It talks about how powerful senior living is for someone like him who had lost his wife, whose kids are busy. He has a daughter whose daughter's busy raising her own family, building her career and how to find meaning and how senior living actually is so valuable in providing meaning and purpose to someone and community. And honestly, a lot of people really they undervalue how important senior living is in providing community to someone and the importance of community in someone's health and well-being. So just excellent film and really, I think, does speak to the importance of that.
Okay, we gotta pull an excerpt for the pod. That's ambitious. I like that. So ways that you're building community, you're thinking about it really strategically. You're even bringing like people in their 20s working at laptops into the same space. I think that's really cool. Do you ever see like people talking to each other?
That's a really good question. I think, as you know, like being somebody that probably does post up at a coffee shop and get some work done. I mean, people are pretty heads down in that environment.
Sure.
But there's a feel that you get when you walk in there. And I think that the fact that those two worlds are colliding shows that there is something there. And there's something that we should be thinking more about as we're building for the future.
Love that. What do you think I don't like saying the top because that puts stress. But what are like the top 3 systemic issues in the senior living space?
So
no need to rank.
The top 3. So one issue is affordability. I think we are good at serving the barbell. Each side of the barbell. We I think do a really good job in the luxury segment where you have really good underlying demographics and people can pay for a premium experience. I think we do a pretty good job actually societally on the other end of the spectrum where you have a lower income, higher needs population, whether that's long-term care or whether that's PACE. I think there are some care and payment models that have been developed that are working. Where we do struggle is that middle market, and it's a societal issue. And I don't think that we've done a great job of coming together to figure out how to solve it. And
if you had a magic wand, like if you just got appointed to Dr. Oz's position in the administration, or I don't know, what are ways, big thinking, that could be used to solve? You're talking about like way we're saving, financial instruments, or
look, I think the one that kind of like jumps out at me would be that let's just take senior living in particular. That's my expertise, my domain expertise. But if you believe that senior living is that you can deliver better health outcomes, then there's some type of shared savings mechanism that can be captured and distributed back to senior living to help offset the cost of care. And so that's one kind of idea, is that more of like a value-based care model where, for that middle market, if you can help, reduce ER visits and hospitalizations and bring the spend down, that spend can be used to offset the cost of senior living. That's one idea.
Do you think that's like a long-term play with insurance?
Yeah, exactly.
Being able to demonstrate to insurance companies, like if they come here, it's going to cost you less.
It could be ACOs. It could be Medicare Advantage plans, and then the other way is like a CMMI demonstration. That'd be kind of the one that would be most aspirational. Is you do like you work with CMS's innovation center, that's CMMI, and you actually develop a care model and a payment model specifically for senior living. I'll tell you, like, it was great to see last year, the release of the GUIDE program, which is specifically for, individuals suffering from a dementia diagnosis. It was very evident, though, that they didn't think about senior living, a community-based setting, when building the program. They were thinking about people in the home. And so I'd love to see a program where the policymakers are specifically working with senior living to build a model that can successfully deliver a service model and a care model to the middle market. So I personally think that why senior living is so valuable is because the obvious to people is, you have a community-based setting, so you can deliver services more efficiently. But the other, I think, more important, more relevant reason is that you can influence both physical determinants of health and then social determinants of health.
Super critical.
And in the home, it's obviously very, very difficult to do that. So
people aging alone.
I
right.
think
you see a lot of innovation now is like virtual reality and
yes,
for people from home. But if we could actually get them in a physical room, you can't beat that.
Absolutely. And there's place for both, right? Like there's not just one winner. You're still gonna have innovation in the home, but I do think that more innovation in the community-based setting to create a model that works for the middle market, I think that would be extremely beneficial from a societal perspective. The other thing that I think is critical is that we really address the long-term workforce crisis in America.
Talking
I think
about like labor crisis and
labor
shortages.
crisis.
Okay.
Yes. It's pretty clear that the backbone of senior living long-term care is built on immigrants. And
I saw 20% currently. Is that the live number?
You would know. Apploi would actually probably know the exact number.
Putting myself on the spot. Yeah, okay. But yeah, it's a growing number.
But this is what I would say is that putting politics aside here, okay, what I hope happens is that the dust settles, that they say, okay, we need to follow through on the mandate. This is what I think will happen. They'll say, we need to follow through on the mandate. We need to secure the borders. What I hope happens then as a next step is they say, okay, we still need sensible immigration reform. And we need to look at areas in this country that we're not currently serving successfully through our population.
Existing immigration,
exactly.
Right.
And then we need to think about how do we attract from outside this country to fill those voids. And I think one great example is caring for the senior population, where historically immigrants, they take pride in caring for seniors. It provides them a better life for themselves and their families. And so everybody benefits, because the resident benefits, the immigrant population benefits. And then also, honestly, it's not taking away anything from Americans, because most Americans don't want to work frontline healthcare jobs.
So you would love to see a shift where how would that work? Bringing in already trained nurses or bringing in unskilled labor with I guess this is like getting into the nitty-gritty of policy, but
it would be more unskilled labor. I mean, it would be caregivers and med techs, because that's really where we have the most pressures in senior living specifically, is filling those positions with people that, candidly want, to work on the front lines and care for our residents.
Is there, maybe this is a fun segue to the technology bit, but are there barriers to, historically, whenever labor gets too expensive, then capital gets cheaper in comparison, and then you see, advances in technology. So there are technological options to replace labor. I don't even mean robotics. I mean like remote patient monitoring. I don't know if this is political. I have no idea. But remote patient monitoring and certainly robotics and sensors and measuring people's vitals and things like that, things where you are reducing your reliance on labor, are there systemic barriers to seeing that adopted? Is that just a train that's coming our way? What are your thoughts on that? Are you adopting that in Solera?
Yes. So I think the answer is both. Okay. So I think you need both sensible immigration reform and you need to implement technology that can help your workforce be more successful, more productive, more efficient. So one of the areas that I'm most excited about is passive monitoring. There's a number of companies out there right now that really stand out to me. We actually piloted passive monitoring solutions over the years. So even in the early days, there was a company called GE Quiet Care that was in like 2009, 2010. They were using infrared technology. Then we tried wearable devices. We're still using wearables. Now you have whether it's video, whether it's radar, sound, where you can capture what's happening in the resident apartment. So it can help to supplement a care plan, which is static. The reason why it's challenging to rely on strictly a care plan is because of time. It's hard to understand the amount of time that it takes per resident to complete a task. And it's hard to understand the amount of time it takes from care staff to complete a task. And so by utilizing passive monitoring, you can better understand time that it takes to deliver services by resident. The other thing that is the reality is there's just a lot of noise. So, there's as needed tasks like toileting. So how frequent is going to drive the amount of time required from your care staff. There's unscheduled tasks. There's emergent tasks. And by, implementing, again, a technology that can help you better understand what's happening in the apartment, you can really understand time. Then you can align your staffing models better to actually fulfill the demands in the community. And then you can better optimize your care fee revenues to align with the actual time that is required. And I think it helps as well in increasing trust because you can be much more transparent with the residents. You can be transparent with the families about what care you're actually providing. And I do believe that it will improve outcomes. It'll drive process improvements. It should help reduce regulatory risk and exposure. So as it probably sounds, I'm pretty bullish on passive monitoring. Why now? I think one of the questions is why now? And there's a couple of reasons. The models. You have a lot of models.
You mean like the LLMs?
Yes. LLMs that have been trained. And so now you're not building the technology and asking the operators to go in mine and figure out what to do with it.
You're walking in with trained data sets already, and that's something that could sell to the operators.
Exactly. And so the data is actionable for the operators. That's a huge, massive shift from where we were historically.
Because you're an early adopter, so they were coming to you and saying, we're going to install this, and 6 months later, maybe we'll have actionable data for you.
They never really were able to deliver on actionable data. It was more, the promise. And we were early, but I think it was important to be early to be understanding what was possible. But now I think the potential is just so much greater. The other thing that's exciting, and Apploi is a great example of this, is just the caliber of the entrepreneurs building in senior care. It's mind-blowing.
You've seen a shift.
A shift is an understatement. I mean, the entrepreneurs today that I talk to that are building in senior care, they are so impressive. They have great pedigrees. They're coming out of, big tech, big healthcare. They They're ambitious, they're driven, they're smart. But you know what they do differently? This is something they do that I didn't see in the past of entrepreneurs building in senior living. They listen to the customer. they actually want to hear
It
what
sounds
the
like a low bar.
operators.
It sounds like a terribly low bar, but it's a high bar. It's a big deal in business.
I bet you if any of those entrepreneurs that have built in the last cycle are tuning in, they deny what I'm saying. But I'm telling you, the entrepreneurs that I talk to today, I mean, look, this morning I sent Adam Lewis an email, and it was actually a cold email that I received from someone that was talking about how to optimize for hiring. I flipped it to him. He responded right away. He copied several people on his team, and they had sent me several times to talk through the things that, are being done at Apploi and to get my feedback on the product roadmap. So
Amazing.
that is not what I saw in the past. And what that tells me is that entrepreneurs today really appreciate how complex this business is and how much buy-in and engagement they need from operators to be successful in actually executing on their business.
That's really cool. We've already talked about some revolutionary technologies, but I never put it to you as the question, especially with your involvement in H-Tech investments. I'm sure a crazy amount of decks across your desk. What's the one piece of technology you think is poised to revolutionize the way we think about aging in the next decade?
Well, I will say I think the technology that I'm most excited about right now is passive monitoring. One thing I didn't touch on that we think about is also the ability for passive monitoring to also track vitals, to do biometric monitoring. The reason why
even remotely without wearables. Yeah, it's pretty
correct,
crazy.
remotely without wearables. The reason why I think this is important is because now you're converging the operating needs with the healthcare needs. So, as an operator, what I want to see is process improvements and staffing efficiencies and care fee optimization. And I want to see improvements in the consistency of our clinical execution. I want to see us reduce regulatory risk. What's interesting about the vitals monitoring is that now we're able to proactively identify when a resident is deviating from their baseline. We're able to identify that. We're able to share that with our third-party healthcare providers that are part of our healthcare network. And we're able to proactively put an intervention in place that can prevent that resident from having hospitalization. Now, we're still early days here on this, but if you just look at the Aura ring, for example, you wear an Aura ring, it tracks your baseline, and then you can detect, oh, you had a bad night's sleep, or, you're coming down with a cold or the flu, and you can change your behaviors. And so I think that senior living right now, just like all of healthcare, is way, way, way too reactive and ultimately needs to be more proactive. And the shift from a fee-for-service model into one that is more value-based and aligning with healthcare providers and becoming a actual part of the healthcare solution is going to help with that shift. So I like the intersection of technology and services. And I do think that, passive monitoring as a whole, and I talked a lot about it, but the ability to also passively take vitals and to monitor those vitals and detect when somebody deviates from a baseline and to put an intervention in place, that's honestly pretty exciting. And moves us from that reactive model to one that is much more proactive.
Are there opponents to that? I remember reading about Medicare putting out a report, and listen, with new technology, there's always going to be bears and there's going to be opponents. But do you think that there's some systemic opposition to seeing more of this?
No, I think the opposition is that our system is a sick care system. and that
Okay. A
it's
much bigger problem.
it's very, very challenging to shift dollars from ones that are focused um,
Fee for
on
service.
testing
Mhm.
and focused on procedures to one that is focused much more on preventative health. So you just look at our spend in America, we wait till there's a crisis. Well,
Sure.
we would be much better off societally if people started to think about their fitness. They started to think about their diet, and they started to think more about sleep. Just those three areas. If we could get our society to shift the mindset and to focus more on the things that you could do proactively to influence your health, we would see a major shift. But it's hard to do that when the way the system is built is that it's a system that provides you those resources if there is a problem. And then you look at senior living in particular, where let's call it what it is. We take care of people at end of life. The average length of stay for assisted living and memory care is 2 years, less than 2 years. So,
Really?
when somebody moves into senior living, not independent living, assisted living and memory care, they have multiple chronic conditions. They're polychronic. They're on 12 and a half meds on average per person. It's a complex resident population. And so, it's much more designed to provide resources for someone to address their needs. Like, hey, this person has cancer, or this person, has depression, or, this person has hypertension. Here's the medications. Here's the treatment plan. It's not meant to provide the dollars to go and to prevent somebody from declining further. But I do believe that we're starting to see that shift with the care and the payment models moving from a fee for service model to a value-based model. I
Yeah,
have to have optimism. I'm an entrepreneur.
you're a big optimist. I keep looking for what are the systemic, there's no systemic, we're good, we're ready to go. I was actually, I've been thinking about for years, how crazy it is that normal consumer health insurance doesn't cover things like gyms or, I mean, not to get too crazy, but wearables, like you were saying, the Oura Ring. And I was just looking at my insurance benefits last week and saw that they cover gym now. So there is a shift. I'd love to know which executive had to sign off on that or how that happened, but it's coming. Value-based care it's a very hot topic now in the senior space. Good thing, obviously think it's a good thing. Who's driving it, and how can operators get ahead of it?
It's a really good thing. And, just like the adoption of technology, with the shift from, fee for service into value-based care, you got to get in the game if you're an operator. And you need to identify a payer provider, payvider who is providing value-based services in your market. And you need to work with them to set that up, build the care model, and start to track outcomes and see what works and see what doesn't. So we partnered with Curana a year and a half ago. We set up a in-community primary care clinic. And, what we found is that it was difficult to get attribution. And so we, worked very closely with them to recalibrate and to figure out how do we build a stronger value proposition for new move-ins so that they see the benefits of aligning with their provider. I think we're still very much in the early days. Right now, you have let's say a nurse practitioner, medical assistant on site, seeing the residents. You'll see that evolve. It's already in place, but you'll see that evolve into a hybrid model where you'll have in community as well as virtual. There are lots of companies out there that have built telehealth models, virtual care models, for primary care and for specialty care. Then you'll ultimately see remote patient monitoring integrated into that model. So you can, as we talked about, you can proactively identify when someone's off from their baseline. You'll see the integration of specialty care. I think it'll be much more common for mental health services, which is very important to me. That mental health services are integrated into that care model. I think that the integration of mental health into primary care will actually lead to much better outcomes. And then I think you'll see wraparound services like, principal care management, chronic care management, guide, which are designed to supplement the services being provided by the primary care provider and the specialist, so that there is a way of staying in front of the residents on a more routine basis, to make sure that they stay at their baseline. And you need those wraparound services because, the models today are not designed to have the same cadence and that same frequency that the wraparound providers are. So I believe that ultimately you'll build a care model for the community-based setting. Senior living will be an integral part of that, and the benefits will accrue to all the stakeholders. So you'll see, a better resident family experience, be better for team member engagement. It'll be better for the provider. It'll be better for the operator, the real estate investor. So I just say, get in the game, stick with it, be patient. It's not going to happen overnight. It's not a silver bullet. But I do think it's the right thing to do. And that's what guides me. I mean, at the end of the day, do the right thing. It's a very, very, very hard business. Operating is not for the faint of heart. You constantly feel like you're failing. It's heavy because, you could be the best and you're still going to have times where, you disappoint a resident or family, you disappoint your team members, you disappoint the investors. To me, at the end of the day, I want to put my head on the pillow, go to sleep at night knowing I'm doing the right things. I'm doing the very best I can by all the stakeholders. And I think that shifting from a fee-for-service to a value-based model, where you're looking more holistically at what's right for the resident, is the best long-term model for everyone.
Love that. What's a misconception about senior living that you wish more people understood, and how does that shape what you're doing at Solera?
I think probably the biggest misconception is that senior living operators and the investors are reaping all these financial benefits.
Mm-hmm.
The reason why is because people don't appreciate how much staff is required to deliver services and care across 3 shifts, morning shift, and then the afternoon shift, overnight shift, 7 days a week. The staff burden is very, very high. And we all know we've had a lot of escalation in wages in the last few years. We've had escalation in insurance costs, real estate taxes, interest rates, moved against us significantly. Lack of liquidity in the marketplace. There's been a lot of financial pressures, and the needs and the expectations of the residents at the same time have increased. So as I mentioned before, we're talking about a high needs population at end of life. Unfortunately, when people move into senior living, they're going to decline.
The deck is stacked against you.
They're going to decline. That doesn't mean, though, that their quality of life won't improve. Their health will decline, but what should happen is their quality of life should improve because they're no longer in their home and they have a community that they're now a part of. And so they're more engaged, they're less isolated, and we all know that isolation leads to a decline in your physical health.
The worst.
So your quality of life is going to be better. But what I find is that the families often think that we are so profitable, and it's challenging because it is very costly to operate. We're all private pay. We don't have any Medicaid reimbursement. So we're all private pay, delivering housekeeping services, delivering culinary services, resident programming, transportation, concierge, and we're delivering care.
On top of
both assistance with daily living and medication administration. It's an expensive model. And you have expensive real estate, and you need to generate a attractive risk-adjusted return in order to attract equity capital to invest in this business. So it's one of the things that honestly is frustrating to me, is that in a lot of other industries, you don't have to apologize for delivering a good service and for running a profitable business.
here you do.
In senior living, people falsely perceive that you're just making all this money, and you have to apologize for doing it. And I think that's sad. And look, I mean, it's not new, but it's gotten to a point where it's become more challenging because of all that inflation that we experienced since COVID, and because of the rise in rates. And so I do wish that families had a better understanding, and I am hopeful, that's why I'm a big fan of passive monitoring, that we can be more transparent with the families. And I think that transparency should help them to better understand the amount of care that we're actually providing. And so they'll have a more complete picture of why we charge the way we charge. And hopefully that will lead to at least that'll mean that we can have a better understanding of each other, if we have the data to support the care side of the equation.
Another point for value-based care.
Yeah.
Okay.
Yes.
Time for fun questions as we wrap up. What is your most life-changing under $150 purchase?
That's a tough one. So I'm
We
very
don't do softballs here.
Yeah, I'm very into experiences. So I love to travel, and I love to eat at good restaurants, with good friends. I also am, as I mentioned, big into health and wellness. And I also am a learner. So I love podcasts, and I really love to read. So if I was going to pick the
Single most.
the single most, I'd say it would be a book, to be honest.
Can you recommend
for me? So I'm gonna it's gonna be split between either Good to Great or Brain Energy. And the reason why I'm gonna say is Good to Great. Yeah, I knew you knew one of them, but Good to Great was kind of the catalyst for me in my thirst for reading about business. And I have read hundreds of books that have influenced the way that I lead people, how I strategize, how I innovate. The other book, Brain Energy, is one that I read in the fourth quarter of 2022. And the reason why is because I was on a business trip and I had a panic attack, and I thought I was having a heart attack. I called an ambulance. I went to the cardiac unit, Tufts Medical Center, and it was a panic attack. my first I've ever had. It came, just totally out of the blue. Nothing triggered it. And so I started reading and listening to, I really started listening to podcasts about health. And the one that I was the most drawn to is Huberman Labs, Andrew Huberman. And he interviewed a guy who wrote this book called Brain Energy. And it's basically about treating mental health through diet. And it's essentially like about cutting out simple carbs, cutting out processed foods, and cutting out sugar. And so I tried it to see if it would help me in reducing stress. And honestly, it was life-changing. It really helped me greater energy, greater mental clarity, and really manage my stress levels. And it got me on the road to just learning a ton about longevity. And that journey continues to today. So that was a hell of a purchase. I think it probably both extended my life and extended the quality of my life.
Wow. Okay. Huge recommendation for Brain Energy. Can you give us some podcast recs also? I heard Huberman.
Yeah, absolutely. So my number one pod is the All In Pod. And it's a weekly podcast with 4 venture capitalists. Candidly, I never miss it. Every single week, it's they talk about business, they talk about politics, they talk about culture, and I just learn a ton from tuning into that. So that'd be my number one. I would say I love Invest Like the Best, and I'll pick it doesn't have to be somebody that I recognize. But like recently he had on a guy, very, very successful investor who was on Scully's flight. And he talked about the experience, where, he knew the plane was going down, and, he had a few minutes left to live, and just kind of how that changed the course of his trajectory of his life and how he thinks about meaning and purpose. And it very much aligns with where I aspire to go as an operator and as an investor, which is, it cannot be solely about the returns, that I have to do something that is meaningful and purposeful and that's making a difference. And so anything that, can inspire me to do better, I personally love. So that a big fan of that pod. I love Lex Friedman interviews. He honestly, both sides of the aisle. He just interviewed the president of Argentina. Gives you kind of a preview. Yeah.
The man. Yeah. Heck yeah.
Incredible. What a great pod. Honestly, like one of the best I've listened to this year, and kind of gives you a glimpse into what we maybe can expect from Doge. So I really enjoyed that. I love, honestly, I love Huberman Labs, as I suggested. So I definitely like to mix in stuff that has to do with health and wellness. But yeah, those are a few of my favorites.
Okay, I want to be respectful of your time. My last question is, you are super well informed. Where do you get your healthcare news, industry news?
So, for senior living, I go to Senior Housing News, every day. It's full of great information. I've been, following them since, the early days when they launched. And I think they do a great job with quality content. I like, there's an individual I follow. His last name is Madden. And he
Not John.
What?
Not John.
His name is Blake Madden. Okay. I should know that. My oldest son's name is Blake. So Blake Madden, and it's healthcare news, and he's just very, very informed, and he provides a lot of links. And so I'll pick like what links are kind of relevant to me. Honestly, LinkedIn is amazing. I follow a lot of, like, I think, thought leaders people that I really respect, and if they'll post something, an article on LinkedIn, I'll read it. So I definitely find that to be, for me, a really good source of news. And honestly, my network. A lot of people, will send me a text, an email. And so if somebody, that I respect, if you send me an email with something, you say, hey, Adam, based on our conversations, I think you'd enjoy this. I'll read it. But I will say, I love to read and I love to listen to podcasts that help me think bigger, help me think more strategically. And I love learning from, the best out there. So I love like Musk's book last year, was one of my favorites. So I never miss out on an opportunity to go beyond healthcare and to take learnings from other industries and apply it into what I'm doing.
Yeah. I mean, I think that's how we started, actually talking about cross-fertilizing from different industries. So that was a good full circle. Adam, this was a really genuinely interesting deep dive podcast. I appreciate your time.
Hey, really appreciate you having me.
Awesome.
Enjoyed the conversation.